Are we ready to start? Do we want to bunch up together? Or we'll have to sing song? Right, my name's Sarah. I'm the Mouth Care Matters lead nurse for the Trust. I think most of you would have seen me at some point over the last sort of 4 months. So I've been in post coming up for 4 months. So part of today is actually just explaining my role, more about the actual Mouth Care Matters project, because actually there's not just me, there will be 16 of us through Kent, Surrey and Sussex. So it's actually part of a wider initiative. Talk about the training that I've already started on the wards and what I plan to do for the rest of the year. And also just talking about a little bit about sort of health promotion, what I've been doing, about some of the oral care products that we will be having on the wards eventually. And also just talking a little bit about sort of possible future plans, patient story, because I think that's always relevant to everybody. And also I have the lovely Jenny, who's going to help me sort of just do a mouth care assessment and just point out the importance of actually carrying out a mouth care assessment and why we should be doing it. So, to start off with the actual Mouth Care Matters project, mouth care is actually very, very important in hospital because our oral health is actually directly impacts our general health. Can anyone kind of think of where that could actually happen?
Sore mouth, not eating.
Yeah, sore mouth, not eating.
Not able to talk.
Yeah. Can anyone name any kind of illnesses that could be directly linked with oral health?
Cancer.
Cancer, yeah, cancer is one of them. Dehydration. Diabetes, would that ring a bell? Yeah, you generally find those that have got diabetes generally have poor gums, so poor wound healing. So diabetes is directly linked with poor oral health. Sorry, Ali?
Smokers?
Yeah, smokers, yeah.
Alcohol.
Yeah.
Overuse though.
Yeah, overuse.
Not
smoke
really
like
yours.
chimney, as I would say. And also kind of thinking of things about if you have got rather frail patients, which we generally do have in this particular hospital, if they have got poor mouths, which then has an impact on their general health, so they stop eating and drinking, it's actually going to increase their fragility, which will then increase their bed stay as well. Okay? Right, looking at these lovely pictures here, this is kind of just gives you an idea of why we actually need the project. Can anyone kind of think what any of these represent? You're more than welcome to come up and have a look.
The one with the flies are awful.
Fungals, that's fungal.
From the ulcer, what are you looking at there?
That's ulcer.
Where, is that in the mouth?
Yeah, that's an ulcer in the mouth. Yeah, that's plaque. That's good old plaque. That's just been left to build up.
What's that? I don't know what that is.
That's an denture. That's not been cleaned probably since Pa fell off the bus. This is the most common one in hospital that we're actually seeing.
Thrush.
No, dry mouth.
Or is that just like scaly?
That's secretions. That's actually your saliva where it's actually
Mouth
dried up.
breathing.
Yeah, mouth breathing. So all these are real life patients. I mean, I'll quickly say these are actually from Surrey, East Surrey Hospital, who actually started out the project, so they're very happy for me to kind of use their pictures. The Mouth Care Matter project actually started at East Surrey Hospital. It was set up by Millie Doshi, who's a special care dentist. How she became involved was that she was asked to see a patient on the ward who was refusing to eat and drink. Basically, they were considering palliative care because she was just getting more and more frail. Millie came down to see her simply because one of the nurses thought, well, if there's a problem in her mouth, could it be her teeth by any chance that she's not eating or drinking? Has she possibly got, ulcers or an abscess or something? Millie had a look. What the patient had been doing was that she'd actually been grinding her tooth where it was actually sore. She was grinding it down the inside of the mouth, which was obviously making it all bleeding and sore. When you have a very sore, bleeding mouth, you don't want to eat or drink. So Millie with her sort of dental nurse team came down every day. They looked at doing like a splint guard to stop her from grinding. And also they were just doing dry mouth care, so trying to keep the mouth nice and moist. So over a period of 2 weeks, they actually got her mouth back to a point that she was able to eat a little and drink a little. And she did actually survive, and they didn't have to go down the palliative care route. So after seeing this particular patient, Millie thought, well, hold on, this is one patient in the hospital. What's the rest of the hospital like? They did an audit, and through that audit, they were able to see actually evidence that mouth care is being done in the hospital, but it's not being picked up with every single patient. So the nurses are doing their role, but patients were being slipping through the net. So Millie thought of looking at the training program, so she did training survey, sent it out to the nurses to ask, would you actually like training in mouth care? Or have you had training in mouth care, would you like a bit more specialised to your role? The feedback was about 70% of the nurses from East Surrey said, well actually, yeah, we would like some mouth care training. One, because we do get it as student nurses, but it might be an essay, or we'll get on the hoc training possibly from speech and language, or we will do a little bit of training as newly inducted nursing assistants. So Millie set up a training program, which I'm actually developing here at Durrant as well. The training program is pretty simple. It's on the wards, so it's looking at just popping onto the wards for 10-15 minutes, whoever's free, just to do a little bit of mouth care training. I actually use the patients, because there's nothing better than a real life patient, to actually do the mouth care training. So for example, on Rowan, Maggie asked me, the sister, could I come and do some mouth care training with her student nurses, because she just feels it's something extra that they should be doing. And she said it's also nice to kind of get someone who deals with mouth care to actually deliver the training as well. So came up into the wards, Maggie had selected a patient that she felt could benefit from mouth care training. I had 3 student nurses. We went over to the patient. I explained to the patient my role, what I would be doing, and would you be happy if the student nurses observed and also carried out mouth care on him as well. He was more than happy. And I was able to, one, demonstrate mouth care to the students with the patient's consent, and then obviously get the students to also practice as well. Because it's all very well telling someone how to do something, it's always better getting them to actually do it themselves as well. Because then you feel a bit more comfortable and confident, especially if it's new products being brought onto the wards as well. Feedback from Maggie was that actually the student nurses really enjoyed that, because one, you didn't talk at them, 2, you actually got in there and did the mouth care with them, and then 3, you actually got them to do the mouth care with you observing just to make sure they felt comfortable, and then you stayed and you actually answered any questions as well. You didn't just run off the ward and go, right, I've done that, I'm off now. So I'm trying to make the training as user-friendly as possible. I am aware of time constraints as well, so that's why I'm very much trying to do the ad hoc training. Also, I'll be on the nursing assistant study day, doing a bit of mouth care training there, and also I'll be tying in the ward training with the care certificate as well. So any of your NAs who are level 2 and level 3 who have to complete the care certificate, mouth care will be part of the personal care section, but I will be working with them on the wards to get that completed. Any questions so far? No? Okay. Right, so a little bit about sort of the objectives of the mouth care project is obviously to increase the awareness of mouth care on the wards. So looking at the mouth, recognising different things you can see in the mouth, ulcers, cancers, dry mouth, and then obviously also knowing what to do with it as well. So, if you have an ulcer, you can refer to the doctor, you can ask the doctor to prescribe some Difflam, that kind of thing, just creating an awareness of what actually goes on in the mouth, and also what different medications can have an effect on the mouth as well. Also just about creating an interactive training program as well. So with doing the ward training, I would look at maybe having a mouth care champion on each ward, possibly a bit like the tissue viability nurses. They've got a link nurse on each ward. So the plan would be to have a mouth care link nurse who would be the kind of the go-to person if I'm not around, and my go-to person on the ward that, what's happening with mouth care, is there any concerns you'd like to raise with me, and also creating a little sort of ward network where maybe once a month the different mouth care leads meet up in one of the wards for 10 minutes. Right, what's happening on your ward, what's working on your ward, what's not working on your ward, how can we as a group actually make it easier to carry mouth care out on the wards. My role is obviously offering advice and support to yourselves, to your team, creating resources So one of the feedback I have had from one of the ones having like a little mouth care booklet. So just a very easy go-to booklet with pictures of the different products and what you can use each product for, and possibly a picture of the different mouths you can see. So you, like a dry mouth, it looks like this, right, that's what we need to do. I mean, I'm keen for any feedback from you guys, but as the sister said, she's just something as a go-to guide if you're not around. So it could be simply looking in the book going, oh right, that's the mouth stick, yep, we use that for that, or that's the product we need to use for this particular patient. Referral service, that's a little bit, it's more for kind of like your high risk patients. So for example, possibly a patient with learning disabilities. So I'll be more than happy to receive a referral for that, because obviously they're quite high risk. So obviously we want mouth care to be carried out. I'm happy to kind of come in as an extra support to your team if you feel that you would like me to come and support with that particular patient. Every contact counts. So in mouth care, who do we think actually, other than the nursing staff and the nursing assistants, who else do you think would encounter mouth care?
Speech therapists.
Yeah, speech therapists. I need to nodding there, dietitians. Who else? Who else do we think can possibly link in with mouth care? Families, yeah, families, relations. They're our secret weapon, really. Pharmacy?
Yeah.
Because it would be pharmacy that the doctors will be referring to in regards to sort of mouth care products that you would need to get from pharmacy. Doctors? Occupational therapy. So even though some of us don't have a direct link with mouth care like our nurses and nursing assistants, we still, on a sort of wider range, do touch on mouth care in little ways as well. Okay. How can we all help with mouth care? How can we help to sort of make our mouths as comfortable as possible?
You're talking about our own, or
Yeah, no, I'll make sure. Yeah, sorry. No question. Hopefully you're going to the dentist.
Having the right products.
Yeah, having the right products.
Yeah. Encouraging patients to use them as well, because obviously they have part to play.
Yeah, they do. They do.
Don't lose dentures if we've got them.
Yes.
I'm asking what they've brought in with them. A
Yeah,
lot of the
exactly.
time, like we go rummaging for stuff, but they've got their toothbrush, their toothpaste,
Yeah.
denture pots.
Yeah, so it's just looking at kind of like how we can kind of incorporate mouth care into the daily routine, which it is in sort of the personal care side of things. But it's like Jenny's saying, it's like speak to the patient, have they brought the toothpaste and toothpaste in? With our dementia patients, you tend to find they may struggle with having mouth care done because they don't actually recognise the toothbrush. So good thing to do, have a chat with the relatives and find out, have they got a particular toothbrush that they use? Because you may find they don't recognise the toothbrush we give them, so they're not able to make that link between the toothbrush and actually that we want to help them clean their teeth, but they may recognise their own toothbrush and make that kind of link that, oh actually yeah, you want to clean your teeth, you don't want to hurt me. I mean, I've been working with a lady with advanced dementia who has refused mouth care initially to start with, simply because it's a natural instinct. Anyone goes near your mouth, you naturally want to back away. And I think with dementia patients, that kind of reasoning kind of slowly goes, especially with the advanced patients. So you want to kind of encourage them and help them as much as possible. And having worked with care homes as well in my previous roles, I found getting the families involved to do the mouth care always helps, because it's a familiar face, and to familiar toothbrush and actually familiar toothpaste as well, because it could be the toothpaste Auntie Flo's got for the patient. They don't really like that minty toothpaste. They prefer their sensitive toothpaste. So that's like the communication side of things as well. Okay. So some of the positive things from the mouth care project at East Surrey Hospital, some things that have actually been said is encouraging the application of dry mouth gels for palliative care patients, because that's one of the things we do find, they do tend to have really dry and sore mouths. So by actually applying a dry mouth gel, actually gives them that comfort. Providing bowls for patients with mobility issues so they're able to carry out their mouth care. So for example, you could have young Jack, who's 24, perfectly able to clean his teeth, but because he's not able to get up the bed to the sink, he's not been able to clean his teeth. So, for example, you have a patient who's self-caring, please enable them to clean their teeth because we want to encourage independence as much as possible. But it might just be making sure that when it comes to the wash that they've got their bowl and they've got the toothbrush handy so they're able to actually carry it out. Also, it's looking at kind of reuniting dentures. Dentures unfortunately go missing a lot in hospital. I can say this as a dental nurse who's worked in practice, where a patient will come into hospital and then we'll get a phone call in practice saying, oh, went to X hospital, had my dentures, I've now lost my dentures. Can you please make me a new set? And making dentures is actually not a quick fix process. It can be up to about 8 weeks. So we then got poor old Flo, who now has no teeth in her mouth, who then is refusing to eat or drink, possibly refusing to go outdoors because of her dignity, because she doesn't want to be going out with no teeth. So you've got all those complications as well. So it's trying to raise awareness about the denture, that if we have our patients with dentures, please can we put them into pots, named pots, or if they've already got their denture pot already, use that, so that we're not losing as many dentures, because dentures can cost up to about £800 to the trust and more. I mean, that's just the figure I've got recently. That's not counting the ones that haven't been reported. Right, health promotion is actually really, really important part of my role. So one of the things I did do last November was the Oral Cancer Awareness Month. So I did a stand down front and basically spoke to patients about sort of mouth cancer. Who do we think are the most obvious patients for mouth cancer? Smokers?
Alcohol.
Alcohol, drinkers?
Both.
Both,
Yeah.
yeah. If we do both, it basically increases the risk.
Yeah.
Back in the day, mouth cancer was generally seen in the over 50s who smoked like chimneys and drank like fishes. Now there's been a complete change. It's younger people, so from about 30 up, and interestingly, it's females. Can anyone think of why that could possibly be?
HPV virus?
That's it, yeah, human papillomavirus. We're finding those that have been diagnosed with oral cancer that they've also had the human papillomavirus. And can anyone think of how it's transmitted?
Yeah.
Oral sex. Now I tried to have that discussion in a high school. It gets quite interesting. But yeah, one of the reasons why oral cancer is on the rise with the younger generation is because of oral sex. Obviously our girls are protected through the HPV vaccine. Interesting enough, when I did do the actual mouth cancer awareness, I did have actually quite a lot of young men come over. And when I was actually explaining to them, actually, the reason why we are seeing it more in the younger generation is because of oral sex. They were generally like, oh, okay, yeah, that kind of makes sense, yeah, okay. And as one said, is that giving or receiving? I said, well, no, I'm not going to comment on that one. But yeah, so I'll be doing, hopefully, the mouth cancer awareness in November. I'll also be doing a Smile Month from June to May, so just raising awareness about the importance of mouth care, and I'll be doing it across children and adults as well. And also looking at maybe doing like a dry mouth awareness day, that kind of thing, just to kind of raise awareness about issues in the mouth. Obviously, any feedback from you guys, greatly appreciated. Any questions? No? Right, oral care products. I'm trying to get what we're calling the mouthy stick, which I'll pass around. This should be, I think, on most of the adult wards now. It will be replacing the foam swabs. They are being phased out slowly. The idea is with the pink foam swabs, there was actually a medical alert issued back in 2012 to all of the hospitals in the NHS. Unfortunately, Darren is one of the only few that still has them. So as part of my role as the mouth care lead, I obviously have to look at patient safety. So it's not because I've come in and gone, oh, I don't like those. It's actually because it was actually issued from government. So the idea is, look, what alternative can we have that is safe for the patients, and also what can we use that's easy for the nurses and LAs to use as well. So having spoken to other trusts and my mouth care colleagues, the mouthpiece stick kind of pretty much passed the test. I know speech and language, you like using them. Do you want to talk about it a bit, Jenny?
Well, we really wanted them for a really long time because we used to find the pink sponges were all right, but the main problem came when they were just left in the bowls for ages, so that they then become soggy and they come apart from the stick that they were held
Is
on.
that the alert?
Yeah.
The phone would come
Yeah.
the choking hazard or something?
Yes.
Is that
Yeah.
Yeah, that's the alert, yeah.
And so the manufacturer of this had come to one of our meetings and highlighted how good they were.
Pass it around.
Yeah, so
It's not been in anyone's mouth.
we've been trying to get them in place because whilst toothbrushes are very good, sometimes you kind of can't quite replace something like that to try to get into people's mouths. And particularly because sometimes the bristles on a toothbrush can be quite rough if you're rubbing them, particularly against patients' gums who have no teeth. Whereas something like that seems to be a little bit better, and it's really effective at cleaning mouths.
They're
really good
effective.
because of the fibres on them.
Yeah, that's right, yeah. When I saw it the first time, I thought, is this gonna, thank you, are the individual strains not eventually breaking off? I don't, you're not gonna get done 100 patients, enough for 600 years, but.
They've got a 12-hour shelf life. What I've actually said to the staff is that if it looks visibly soiled or looks visibly kind of, the bristles will obviously go a little bit, but because this silicone is soft, it's not like a toothbrush bristle where it's going to just splay. But it will obviously get a little bit of wear and tear, obviously, if it's been used quite a lot. But then it's obviously using your own, discretion and infection control hence that it looks visibly
Just
soiled.
have a protocol that they change 8 in the morning and 8 in the evening every day.
Yeah.
So that they're done every 12 hours.
Yeah.
Is that your recommendation, 12 hours?
That's a recommendation from the actual mouthpiece company.
Gosh, that's not a lot.
But in a way,
I know the phone,
pink
there was only one.
Yeah,
one application never did.
We fill up like
Extra 12 hours, yeah.
So it's too expensive, you have one for 24 hours, yeah.
Yeah. I mean, it's
Send one
also...
off to the lab and see what it grows.
Yeah.
Yeah.
I'll send it off to them. Go, guys, can you just test this for me?
Also, you can't bite bits off it, which is another thing that
Well, that
was
wasn't-
quite
yeah,
important.
yeah.
It's not, even though it kind of looks like you probably could, I don't think you can.
Well, the procurement team, what they did for a week for me, they said they sat there trying to pull it off and bite it off, and I'm just like, did it work? No.
Yeah.
And I had a patient yesterday, an elderly lady, who, yes, she did bite down on it, but then it was interesting because it almost created a sucking action. Because she kind of bit down and she kind of started sucking on it. For her, that actually gave her a bit of relief actually. So they appear and they seem to work very, very durable. But obviously it's just, if it looks a little bit worn and torn, obviously just bin it. But you haven't, and you can leave them in water and you can leave them in the gel clear. There's no risk of the foam swab coming off. I mean, even I found just getting them out of the packets, I've popped the heads off and I'm like, whoops, I've done that quickly. In regards to really, really dry mouths, the plan is that I'm going to get oral leave gel onto the wards. I'll just pass the little box round. So what it is, it's a dry mouth gel that can be applied on the cheeks, on the palate, on the tongue, and it can be just left there, sort of massaged in. And it gives the patients a good 4 to 6 hours relief from dry mouth. So my plan is to hopefully patients who are on oxygen, who are nil by mouth, we automatically start doing the dry mouth gel to prevent it getting to the point where you've got very, very dry secretions and you're having to actually pull those off, as I had to do with a lady this morning, bless her. So with the oral leaf gel, should be coming onto the wards hopefully next week. There's been a bit of an issue with the main distributors. So myself and the Mouth Care Matters lead Sam in Medway, so we're kind of working quite closely as well, ended up going to the main distributors with our procurement team and actually saying, well, we actually need this product. We've got patients with a lot of dry mouths, we can't get it. So they said, no problem, we'll sort it out, but it will take about a good 2-3 weeks. So hopefully, you should be having it on your top up on the wards. You'll probably notice you've got toothbrushes on the wards again. I know they are the little NHS toothbrushes. My budget, they're better than nothing, thank you. they're a start, because
Yeah.
obviously what I don't want to be doing as well, I'm only here for a year. So whatever I bring in place, I want something that can actually continue. And I think if I started bringing out all the fancy toothbrushes, I think it'd be like, no. Sorry, my budget doesn't go that far. So we've got the little plastic NHS toothbrushes. They're better than nothing. If the patient's relatives are a bit, well, it's a bit hard, we can then encourage you to go, well, you can buy them a toothbrush and bring it in yourself. Although with ebony, because a lot of our patients are interdentulous, so no teeth whatsoever, so a lot of gummy smiles, I have got them soft toothbrushes, simply because the NHS toothbrushes are that little bit hard for their gums. And I think Rosewood as well, where we've got a lot of the radiotherapy and chemotherapies as well. It could be later on in the year, if you wanted maybe some soft toothbrushes for certain patients, maybe that's something I could discuss with procurement, that I have a box myself, and then if I was to see the patient, or you were to say, oh, you know, got one patient, she's got just gums, she's got no teeth, the toothbrush is really hard, her relatives up north, could we possibly maybe have some soft toothbrush for her? So, you know, I'm more than happy to work that way as well. Any questions?
I was just going to say a really important thing about these new Twizzly sticks is that unlike the sponges, nil-by-mouth patients would often, they don't hold water, so like you can't leave them in the water and then suck all of the liquid out of them and effectively aspirate on what is a glass of water when you've just been sucking on pink sponges. This is like, it'll retain moisture, but not enough that patients are going to be aspirating on the fluid. The same for the Oraleaf gel, it's thick enough that it'll stick to the gums rather than we used to use spray in the past, which patients were aspirating on.
Yeah. So, and also, so that's kind of the product side of things. So I've got toothbrushes back on the walls, sort of some soft toothbrushes, Oraleaf gel, and sort of the mouthpiece sticks as well. Obviously, any feedback from you guys, always greatly welcome in regards to products. Right, so future plans. Who's seen the oral care assessment tool? Who's used it?
Well, we had the old one, I don't know if you've got it in place now.
Right, so we've got the old one. Who likes using it? Who knows how to use it? You can be completely honest, because
No, I've never.
I tried using it, and I mean, my background is oral care and dental nursing, and even I'm like, I haven't got time to sit and try and score something and then go, well, hold on, what does that score mean again? So I'm at the moment developing what I'm calling idiot-proof toolkit, where basically you look in the mouth is, the tongue's nice and big, right, I don't need to do anything. The tongue is looking really dry, right, no, I need to start doing some dry mouth care. So that's the kind of toolkit I'm looking at putting together. I've actually got an example of it, which I'm quite happy to pass around. I have shown it to some of the inmates on the wards, and their feedback actually is, yeah, we like that. It's much easier than the previous thing we had to use. And also part of it will be having, let's pop this one off actually, is looking at having that kind of on every wall, so it's almost like a go-to reference. Right, when we're talking about tongues, when you mean dry tongue, oh right, it looks like this, because there's nothing better than something visual. And mouth care is very much a visual thing at the end of the day. It's a very practical skill, and it's a very visual skill. Right. Any questions? How are we doing for time, Sarah?
Fine.
Yeah?
4:10.
Jenny! Yeah. The lovely Jenny is going to help me out just doing a mouth care assessment, just to show how important it is actually to have a look in the mouth. Yeah, do you want to sit? Yeah. Let's pop some gloves on.
How do the nurses refer to you, Sarah?
At the
Is it a
moment,
phone call to either dietetics or SLT, or have
at
you
the
got a bleep or
moment, I'm
anything for
trying,
them?
well, I haven't got a bleep, unfortunately. I think the plan is, because I'm always on the move between ward, dietitian's office and speech and language, it would be kind of by email. So at the moment I'm in talks with Joe, who's my lead, and obviously yourself, Jenny, about a referral form, but only really if you feel the mouth care requires that support. So initially, complete the mouth care assessment tool, start the mouth care, and if you feel the mouth's not getting any better, then I'm more than happy to come in on the support and advice side. I'll be on the wards, obviously, delivering the training. So if you do see me there, like this morning, I was on beach reviewing a patient, and one of the nurses said, Sarah, have you got 5 minutes quickly? We've got this lady. She's got really sore gums and bleeding gums. You know, can you have a quick look? So I had a quick look and said, right, I'll come back tomorrow, we'll do some toothbrushing. Because what she just had was really, really inflamed gums, just where all the plaques built up, and it just made her gums really inflamed. The minute you get a toothbrush to them, they start bleeding. So I'll go back tomorrow and do like a
What's
toothbrushing
your connections with the dental department that are already here?
Right, MaxVax, so the maxillofacial team. Has anyone referred to them before? Yeah?
Yes.
I am connected to them. I mean, I did actually pop down and see them on my first day, simply because I didn't want it getting up. We have a dental nurse on the wards giving mouth care advice. I don't want to be treading on anybody's toes. So my connection with the oral surgery is simply, if you see anything in the mouth that doesn't look right, any lumps or bumps that have been there longer than 2 weeks, you can ask your doctors to do just a simple letter to the MaxVax team, and one of the consultants will actually come up and see them on a review. So that's kind of my link that way. In regards to actually carrying out dentistry, unfortunately we haven't actually got any actual dentists on site. They're oral surgeons and they're outpatients. So they normally see patients on an appointment basis. But if we have had the, I mean, and you can actually tell your story actually about your patient.
We had a gentleman with severe learning disabilities that came into the emergency department, and he'd fallen on his face and he broke one of his teeth. He'd knocked, so it was really loose, but there was a risk that he was going to aspirate on it. But A&E wouldn't remove the tooth, so I ran down to MaxVax, and the lovely consultant was like, bring him down. We literally wheeled him down. They removed the tooth and we wheeled him back to the emergency department again.
Yeah.
Quite a quick response.
So Mr.
It was
Howell,
literally just, I
Yeah,
think we had,
Mr. Howell.
yeah, it was Mr. Howell.
the go-to man, really.
Yeah.
He's always
He was
been
just
that,
like,
hasn't he?
come back in. It was like, well, we're going to be here a good few hours, so come back like, I think it was straight after lunch before the clinic started, and he was like in there, out, back in the emergency department
I
again.
mean, it's good for me as well, because even though I've got the lovely Jenny and I've got Joe and I've got the team, dentally it's nice to have a go-to person for myself, so I know if I need a second opinion, if I've seen something where I'm like, I'm not sure about this, I've got the sort of the go-to as well with the MaxVax team as well. But, you know, I'm always on hand. If you do see something in the mouth and you are thinking, it doesn't look right, please refer, because I think, especially with the rise of oral cancers, a lot of it's been left too late. To the point it always gets to third stage.
In regards to the referral process, if you disappear in a year's time,
Yeah, this is
then
what,
very little point in starting to teach
That's
people
our
to refer.
concern.
yeah, that's our concern at the moment. That's what we're in talks with at the moment.
If it becomes an order column, and then people,
Yeah, yeah.
Yeah.
suddenly there's like 20 referrals a week,
Yeah.
and then it becomes 20 referrals to
Yeah.
speech therapy, or 20 referrals
Yeah.
to dietitians.
Who's going to take it on?
Yeah. I mean, at the moment, I think we're working on the basis that I'm delivering the training, so getting the nurses to complete the mouth care assessment tool, and then working on also carrying out the mouth care on the ward. So we're doing it on a kind of a training basis, and then looking at how we do a referral system that if, sadly, I do end up going in October, then how can we carry this out further, basically? How can we continue it so that the patients don't suffer? So yeah, no, we're kind of trying to sort that out at the moment, not with Jenny. Because also, I'm also only one person as well, and I've pretty much got the adult wards from Redwood all the way up to Linton. So it's kind of working with you guys as well. But maybe that's kind of when maybe the mouth care link liaison nurses and aides will probably come in as well, is trying to create almost like a mouth care network as well. And working with our doctors, because actually the doctor is actually the higher person than me, because I can't actually diagnose. I can recommend, so I can look at a tongue and go, it's got a white coating, doctor, please can you have a look? Although in my own professional experience, I know that's thrush. So a lot of the more serious things on the mouth care tool are actually going to be referred to doctor as well. So I'll be covering that out on the doctor's training as well. You ready, Jenny?
Yeah.
Yeah.
Hopefully you don't do much to me.
Oh, I'm not planning on doing cleaning your teeth, bless you.
Been scrubbing it too.
It's really went to toothpaste there, Jenny. So when we're carrying out a mouth care assessment, it's really important, especially with patients that have got hearing disabilities or sight disabilities, that you actually tell them what you're doing. There's nothing worse than someone coming round to your mouth and you're thinking, hold on, what are you doing? So explain to your patients what you are doing.
Checking your pupils.
And also stand where they can actually see you as well. And also where you're not kind of bending over them as well, because sometimes that can be really frightening, especially if they're sitting up in bed as well. So the first thing you want to look at, Jenny's looking right. First you want to obviously have a look at is the lips. So, you know, do they look pink and moist? Are they actually able to open their mouth as well? So, Jenny, your lips look a little bit dry on the bottom there. But I think we'll put that down to just the winter and the heating and things like that. So, Jenny, can you just open wide for me? So, can you pop your tongue out for me? Right, so Jenny's tongue's nice and pink, okay?
Oh,
See it from
no.
here.
Yeah!
Turn the lights down so we don't
Jenny, can you pop your tongue this way towards me? Okay, so have a look at the underside of the tongue. And the other way, okay? Why do you think I'm going to be looking at the tongue? Why do you think the tongue's
Or is it for the abrasions, maybe? For
the
acid or
abrasions?
something, or ulcerations.
ulcerations? And also it's the most common site of cancer. So it's under your tongue.
Yeah.
Okay, and then open close, bite together. So we just have a look at the sort of the top gum, so it's all nice and pink, it's not bleeding. And we look at the bottom, so have a look at the lower lips as well. There's no ulcerations. And the teeth are nice and clean, there's no plaque.
Thank you.
So yeah, so that's the importance of the mouth care assessment, is because actually in just that little 5 minutes, you can actually pick up quite a lot. So if you do see someone who's got an ulcer, refer to the doctor. I mean, most ulcers, unfortunately, especially in hospital care, you generally find can be kind of a side effect of the medication if they're feeling run down. I mean, who's felt run down before and got massive ulcers?
Yeah.
So unfortunately, that is kind of one of the side effects you will find. And also, especially with our chemoradiotherapy patients, you find they'll get a lot of ulcers, what we call sort of mucositis, and also that sort of burning sensation in the mouth as well. And cold sores, you will see a few cold sores as well, so you want to refer to your doctor. So it's almost like by doing the mouth care assessment, you can pick things up quite quickly. And also, if they're not eating or drinking, have a look at the mouth. Because sometimes it could just be because they've got a sore mouth, that's why they're not eating or drinking. Okay, so after sort of performing the mouth care assessment, what you want to do is obviously just record your findings. That's why at the back of the mouth care assessment tool, I've just got very simply, you know, what you've done. You know, is it pink? Yes. Yeah. And obviously just record any sort of mouth care that you've carried out. I've done the mouth care assessment tool in a way you've got little acronyms, simply because it just specifies the mouth care given. So it's kind of a little bit more in line with sort of CQC. CQC in mouth care is part of care, it's part of personal care, so it's something well within the right of a CQC inspector to ask an nail nurse, oh, what do you do in your job role? Oh, I do personal care. Oh, what do you do in the personal care? Oh, I do mouth care. Oh, tell me a little bit about mouth care. Where do you record the mouth care? So the CQC is very, very well within their rights to actually ask about mouth care, as they would about personal care or wound care as well. So to finish off, I'm going to talk a little bit about a personal story. You can go, sorry Jenny. Thank you. You can go. There was a lady that I got to know who was referred to me via the dietitian. Excuse me, I'm back for a second. Referred to me via the dietitians. She wasn't eating, she wasn't drinking. So I was asked to see her at our court. Interestingly enough, we did a little bit of digging just to find out how long we had her in our care. We had her from September 2016. She left our court, I think, the end of January, I think.
20th of December.
Sorry, oops. Still blowing into one. But the lady that I saw, she was elderly, frail, dementia, 82 years old. When I first saw her, I'll pass it round, the top picture is what I was presented with. She had a massive swollen lip, ulcerated, bleeding. Because her mouth was so sore and swollen, I could hardly see in there. And even I was quite shocked by how bad her lip was. She looked like Leslie Ash Trouthouse, basically. It looked like someone had actually punched her in the mouth. So I spoke to the sisters, spoke to the nursing team and said, right, what we need to do is obviously start doing a little bit of lip care. So we need to keep her mouth nice and moist. So if she's got a favourite lip balm or some Vaseline, she wasn't on oxygen, so we were able to use Vaseline. And I said, just regularly apply that. Also, because she's got dementia, get her a mirror. Show her why her mouth looks so sore and show her what you're doing. I mean, initially, she was not having a bar of me going anywhere near her. So I started a little bit of lip care. I agreed with the nursing team on this particular case. I would come in daily, simply so she could actually recognise me and get used to seeing me. And the care plan I left with the nursing staff was simply little and often. So, you know, apply some Vaseline, and where you can, try and see if you can get some dry mouth gel into the mouth to try and moisten it, to try and make it a little bit easier, because she wasn't opening her mouth. Also, because her mouth was so sore, she wasn't able to take her medication. It was tablet form. So the next morning I saw her, the tablet was stuck there, wasn't going anywhere. So I spoke to Dr. Weeks, one of the doctors, and said, is there a possibility that maybe we could just review her medication and see what we can make orally rather than tablet form, just so it's a little bit easier for her to actually get down because she's refusing the medication. So over kind of the last, sort of over the weeks, we kind of went from a very swollen sore mouth to actually providing dry mouth care, so getting sort of the biotine oral gel in there, doing a little bit of toothbrushing, and it got to the point I was actually able to do a proper mouth care assessment on the lady and actually be able to have a look. So she went from kind of that to that over 2 weeks. And as Joe Wheeler said very kindly, I even got rid of a double chin as well.
So
I
what was
just
the
passed that
cause of it? Just lack of care?
I think part of it was possibly lack of care. Two was also what she was doing unconsciously, was she was grinding. And you do, I'm realising now that a lot of patients with advanced dementia, they grind unconsciously. Yeah, she'd ground all that. Literally, it looked like it was up here. So I think some of it was because she was refusing, and I think because the staff didn't really know how to handle her, and I'm trying to say this very nicely, it was like, well, she's refusing, we're going to leave her. In fairness, I'm used to dealing with the mouth, I'm used to getting my hands in the mouth. So I'm happy to get in there, and I kind of know a little bit of tricks, you know, how to get in there. But it's trying to reassure the patient, and as I said to him, I said, she's a morning person, do the mouth care in the morning. She responds so much better in the morning. So it's thinking, if we have those more difficult patients, think when's the best time for them? Are they an afternoon person? Are they a morning person?
It's the same with the food actually.
Yeah.
Better times in the day.
Yeah. And
We all
also,
tend to actually.
Yeah.
It's not just
you know, if you came to do mouth care at me at 7 o'clock at night, I'll be falling asleep. I'm not an evening person at all. I'm more of a morning person. And also, it's working with the doctors. I mean, Dr. Reed was great. He said, no, that's brilliant. Let's have a look and see if we can actually get some of this into oral forms, because obviously it's a benefit for them. Because she's refusing the medication because her mouth is sore. And then working with the nursing team as well, saying, well, if we just do a little bit of mouth care, little and often, and what she can tolerate as well. So you don't want to be going in there going, right, we're going to clean your teeth, that's it, hold her down. That's not going to work, because she's just going to refuse it, and it's going to make it harder. So even if you just started doing a little bit of lip care, see how she gets on with that. I know there's the time constraint. And then maybe going back a little bit later, saying, oh, let's see if we can try and brush your teeth a little bit. Let's see what you can tolerate. So it's working with the team, it's working with the doctors, and also working like with the dietitian's team, with Sarah. So on my side of things, I was also monitoring what she was eating and drinking. So she went from being refusing anything to actually having Ribena with a straw and a little bit of porridge. So that, for me, was also an indicator that her mouth was actually getting a little bit better. Interesting enough, she had a denture. Now, having looked in her mouth, I was expecting the most mankiest piece of equipment ever. Boy, was I surprised. It was pristine. It was clean. Which made me kind of think the social situation was probably before the dementia got so bad, she was probably a neat, clean little lady who probably went to the dentist twice a year, probably cleaned her denture after every meal. So it was quite interesting for me, because you do kind of make those sort of social assumptions that, well, her mouth is really manky, she probably doesn't look after herself, doesn't look after her dentures, and actually she had a very clean denture. So it made me kind of also realise you can't judge someone on just the mouths as well. Any questions? No? That's it.
Thank you.
That's
Thank you very much.
Good.
That's okay. Thank you.